Let me welcome all of you to the Academy and many of you to New York. It's a bit of a crowded week to be here. Just stay away from the east side from about 50th Street down to about 30th Street. You'll be okay. We were established in 1847 by a group of physicians in New York who wanted to improve the quality of health care. So we solved that one. And then we moved on over the years to be involved in some really important public health issues. We were very instrumental, this organization was very instrumental in establishing the Board of Health in New York City towards the end of the 19th century. We were active in establishing infant immunization practices, infant feeding practices, maternal mortality in the 1930s. We're doing it again this year, which is very sad. New York ranks the lowest, one of the lowest in the country on infant mortality, maternal mortality. The legalization of marijuana in the 50s, we were in favor of it. HIV/AIDS, needle exchange, substance abuse, a lot of work on policy, providing evidence for policy in terms of syringe distribution at pharmacies. And after 9/11, we're very involved in post-traumatic stress syndrome among school children. So we really try to work on some of the key issues, and our current priorities within the umbrella of urban health are healthy aging, prevention, and eliminating health disparities. And we work as a sort of think tank, do tank. We have research, we have policy advocacy, program involvement, and community engagement. We try to work on the kind of continuum that's represented by this very important meeting, which is global to local. An example of our current work, we've taken the World Health Organization model for an age-friendly city, and we've been working on it in New York City for the past 4 years, and really moving it from our own East Harlem community 3.5 years ago to aging improvement districts in 4 other parts of the city, and we're hoping to take that citywide over the next several years. Our learnings from New York have also allowed us to work with colleagues in other large cities, Philadelphia, Chicago, Oakland, who are taking on the Age-Friendly Cities activity. We're one of our colleagues with Finkelstein, who's our Vice President for Policy, just returned from Tokyo and Taiwan, presenting the New York experience to the global Age-Friendly Cities movement. And I think this is a really nice model. There's a terrific network. They signed something called the Dublin Declaration about a year ago, and really learning from each other, a global network of cities learning from each other how to apply the principles of age-friendly in their own context, which always is the key. Fundamental to age-friendly cities, and I would argue health literacy, is starting with the voices of older persons, in this case of age-friendly, but of the patient or the community. And we ask very simple questions. What makes it harder or easier for you to live an active and engaged life in your community? And that has led to major policy changes in the city of New York over the last 2 to 3 years. Some of the street islands that you see, benches on the sidewalks, traffic lights with timers that go more slowly so older persons can actually get across the street. And we've gone from one public pool with senior hours set aside in East Harlem, evaluating that demonstration, to 17 last summer, and every city pool will be have senior hours next summer. So it's an example of starting small from the voice of the individuals most involved and really making major policy change. This approach is fundamental to the Accountable Care Act, both at the patient level and at the prevention, community-based prevention level. So your meeting is very relevant to U.S. policy, and the approach you've taken of really reflects also a fundamental commitment of the Institute of Medicine. We are working very hard to increasingly integrate the work of the IOM on the domestic side and the international side. Recently, the Council of the Institute of Medicine voted to increase the number of foreign associate members from 5 to 10 every year, and there will be an increasing policy effort to add international scholars to all of studies and areas of their expertise. Also looking at models for taking Institute of Medicine products, if you will, studies and workshops, and working with academies in other countries to apply it to their context when they're interested in those efforts. And some of those have been very successful. So what you will be doing today, I think, is a terrific paradigm, and we really hope that perhaps this may be, we can say that the New York Academy of Medicine was a venue for the beginning of a global effort to really develop a health literacy community from which we can all learn from each other and move this issue ahead. So welcome and enjoy the day.